Hello, my name is Jose Miranda Velasquez. This video is for BSN 225-21. This video is the administration of intradermal injections. I'm in my Nightingale scrubs. You can see my badge. Got nothing on my hands. I want to point out I'm recording using my phone and a tripod so that you can see from head to abdomen, essentially. On my computer, it couldn't. So to start off, I just wanted to point that out. To start off, I would gather my supplies. First, I have my medication vial. Pair of gloves, gauze, pad, my alcohol wipes. Next, I have the syringe and a needle. I want to point out that we'll be using or needing, not using, but needing a 29 to 30 gauge half-inch needle with 1 milliliter syringe. But due to the supplies given, this is the syringe I will be using. Okay, my supplies are ready to go. Next, I will verify the 6 rights of patient administration. Those 6 rights are the right patient, the right medication, the right dose, the right route, the right time, and the right documentation. After, I do need to do a verification check of the medication with the EHR. Once that is done, this is the first step. The first step is to verify the medication with the MAR. I need to check this a total of 3 different times before I can administer any sort of medication to the patient. This is number 1 out of the 3. The medication ordered today by the doctor is tuberculin purified protein derivative. It is 0.1 milliliters. Is what the order is for. On hand, I have 5 units per 1 milliliter. So again, my patient will receive just the 1 dose of 0.1 milliliters itself. That was a tongue twister. All right, so once I will gather my medications and my supplies, I will head towards the patient's room. I will knock, enter, let myself in, close the door behind me to ensure patient privacy and to avoid any HIPAA violations. I would set my supplies down on a clean, dry, and flat surface and perform hand hygiene almost immediately if I can. I'd introduce myself to the patient. Hello, my name is Jose. I'm one of the nurses here. Can I have you state your name, your date of birth, and medical record number if you know it? Along with checking the patient's wristband, I need to verify 2 patient identifiers. Once I've done that, I can go ahead and proceed with the patient. Thank you, Mr. Miranda. Are you allergic to anything that we're not aware of? No? Thank you. Now that I am in the room and can have seen my patient, I would then go ahead and check the medications with the MAR to verify that this is who the medication's for. This would be the 2nd time I'm doing so out of the 3. Okay, Mr. Miranda, as you can see, I have stuff here in front of me for an injection. Your doctor ordered you to have a PPD test done. It is commonly known as a PPD test, but the name of the medication is tuberculin purified protein derivative. The mechanism of action is that it causes a delayed and hypersensitivity lymphocyte reaction. We use this medication. We use it as a form of a test. It goes into the skin. We inject the medication on the top layer of the skin here, like so on the forearm, to diagnose whether you've been exposed to tuberculosis or TB, or if you've had it in the past. It is a test that takes about 72 hours. After that, 72 hours, you come back and we will assist by reading the test, essentially. On the forearm here, we take a look. I want to point out some common side effects that go along with this medication is that there is some bleeding from the site for a couple of seconds once we remove the syringe. There could be some itching and some swelling as time progresses. I don't want you to rub or scratch it. We don't want to irritate the skin or the site of the injection. There could be some adverse reactions, which could be some shortness of breath, fever, rash from the face to the arms, or potentially all over the body. If any of this happens, please do let me know immediately. We contact your doctor. If you once you leave today, if that happens while you're at home, come back immediately. Go to the ER. Call 911 if you need to. Okay, do you have any questions for me? No questions? Perfect. At this point in time, I would then go ahead and check the medication with the MAR, 3rd and final time, to ensure that this medication is for this patient. Moving forward, I would perform hand hygiene and don my gloves. Okay, Mr. Miranda, I want to let you know that upon administering the medication, you might feel some slight stinging or burning sensation on the site. This is common, and I just want to make you aware of that. I also wanted to reiterate that the needle and the syringe that I'm using is a 29, that would need is 29 to 30 gauge, half-inch needle that has a 1 ml syringe. So, first and foremost, I'll start by the preparation off, and I will remove everything from the packaging and dispose of it. I want to clean the top of my vial. Alcohol prep pad here. Discard that. I have my syringe. So I want to hold my syringe up like a pencil, needle up, cap on. I want to then draw 0.1 milliliters of air. It's kind of hard to see, but I'll bring it up close. So, from this point on, I will, if I haven't done so already, like I said, I will clean the top of the medication vial with the alcohol and discard that in the trash. I just did that. I will then remove the cap of my needle, or my syringe, pardon, and I will inject the air that I just pulled out into the vial, and I will then draw the solution desired of the amount of 0.01 milliliters. Oh, before I go tipping, and almost forgot there, I want to push the air into the vial. Okay, air is in. I'll go ahead and flip it. I'm drawing 0.01. When drawing the solution, sometimes there's air bubbles. They can be in the syringe, or air bubbles get stuck in the syringe. So I just need to flick the syringe a little bit to have the bubbles move up to the top and essentially disappear. Sometimes injecting the solution back into the vial and drawing it back up might help. Okay, in this circumstance, there are no air bubbles that present. Okay. Just double checking. I'll place my vial back on the table. I'll show you the 0.01. Oh, you can see that there. So, ideally, once I remove the syringe from the vial, I want to recap it almost immediately. Using the swoop method, where we swoop the lid. So I will go ahead and swoop. And place my cap back on. Let me see, where am I at in my process here? I want to make sure that the cap, I can come on the sides and secure the cap on correctly. All my medications, at this point, I would consider them ready to go. And like I said, I showed earlier, 0.01 milliliters. Move this out of the way. Next, would want to select an appropriate site for the intradural injection. Typically, you can use the forearm. If that's not the case, the upper back area. So I'm going to show you on my arm here. Typically 3 to 4 inches below the antecubital space here on one hand space above the wrist. Oh, 3 to 4 inches. I don't know if you can see that. 3 to 4 inches, or 1 inch above the wrist. We want to run the hand down the middle of the forearm, essentially right in the middle from the patient here, or maybe a little bit higher up. It just depends. So 3 to 4 inches towards the middle of the forearm, or maybe a little bit up from the wrist itself, right in the middle of the forearm. Essentially, is what we want. So after selecting the site, I want to assess the site. I want to make sure there aren't any lesions, any discoloration. I want to assess for any tenderness, and essentially I want to ensure that the site is acceptable. Then I would get alcohol wipe, and clean the site. Like I said, starting at the center and clean outward. Well, when I'm cleaning it, I want to start at the center and clean outward about 2 inches. Get my alcohol pad. So start at the center and clean out in the circle, circular motion, 2 inches out. Now letting that dry, I have cleaned it. Well, I'm letting it dry, but since I have cleaned this, I don't want to touch it. And I want to point out that when injecting, I want to use the thumb and the index finger, like this, to hold my syringe so I can remove the cap safely. And like I said, I want to ensure that the bubble portion of the syringe is essentially moving upward upon injection. So this portion upward while I'm injecting. And I will inject the needle with the bevel up at a 5 to 15 degree angle. I need to ensure that I feel the resistance, for which case, once I start to inject, I can do is once I feel the resistance, I can keep inject, or not essentially keep moving, but that's how I know I'm at the spot I need to be. All right, so here we go. Removing my cap. I have my syringe. Want to hold it down. And at a 5 to 15 degree angle, I go ahead and inject. Okay, I'm there. So at this point, I advance the needle through the epidermis about 1/8 of an inch and slowly inject the medication. Okay, almost immediately I see a small blob that's about 6 to 10 millimeters in size. It resembles almost a mosquito bite. Okay, at this point, I want to grab my gauze and I start the removal of the needle. I want to gently apply the gauze to the gauze pad to the top and dispose of the needle in my sharps container immediately. So here we go. Removing the needle, placing the gauze on there, disposing of my syringe. I want to cap my syringe, safety, if I can. If not, just go ahead and just discard it into my sharps container. We'll discard of that. With the gauze, I want to place it on top. I don't want to press, scratch, massage the little blob, essentially the little mosquito bite here, as it could create an irritation under the skin. I simply want to just put it there gently to capture any of the blood if any is bleeding. In this circumstance, there is no bleeding. You can lift up and don't see anything. So there's no bleeding, so there's no need for a band-aid. Go ahead and remove the gauze. Once I'm done, I can check on my patient. Mr. Miranda, are you okay? Okay, you feeling okay? Okay, so I want to gather all my things, if I can simultaneously, But I want to ensure that I'm providing Mr. Miranda with that care, making sure that he is cared for. But I want to gather my supplies, clean up, get rid of my trash, discard that. Like I said, I want to make sure, check on Mr. Miranda, make sure he's comfortable, which in this case he states he is. I want to make sure that Mr. Miranda has a call out within reach and the bed is in an appropriate position. I can remove my gloves, dispose of them, perform my hand hygiene, and document my results. Thank you so much.